1 o'clock, so I think that we should get started. So welcome to the health and safety session, if that's where you want to be or the right place. So the objective is to identify what has and hasn't worked in prior outbreaks when protecting the wastewater workforce, and to co-develop a list of practical considerations and best practices for future health and safety preparedness. So your moderator today is Scott Bessler, and he is the chief of the Compliance Services Division of the Metropolitan Sewer District of Greater Cincinnati. So, go for it.
Thank you, Carly. I appreciate the introduction, and I'm happy to be here to talk to you guys about and have a conversation around worker health and safety in wastewater. So I wanted to start with a little bit of an intro. With show of hands, how many of the people in the room or online have ever been to, toured, or worked in a wastewater treatment plant? So a lot of folks here. Do you remember how serious PPE was stressed when you visited? Yeah. If you did. It depends, I think, on who you talk to and how it's handled. And I think that's important. So keep that in mind. Do you guys remember what might have been required or suggested as you went in? Any thoughts? Like, we'll talk about it more, but was it a hard hat? Was it safety glasses, steel-toe boots, standard kind of PPE stuff. But the more I dig into this question,
hat, we got a hard hat.
A hard hat, yeah. So the more I dig into this question, the more variability I find when I talk to other utilities. And today we're going to hear from a few speakers in the wastewater sector about health and safety in the industry. You'll hear some various perspectives. First, we'll talk to Mark LeChevallier on his work related to health and safety recommendations based on lessons learned on past issues that we have. And then you'll hear a bit from Mary-Francis from Racine and Meghan Feuk from LOTT Clean Water, and yours truly from the Sewer District. And then Anna will wax poetic a little bit about things too. You'll hear about our PPE cultures and how safety cultures vary across the utilities and what some of the drivers and differences in safety cultures might be derived from. So if that sounds interesting, sit back, lock in, and let's start a much needed wastewater worker health and safety conversation. So I'll throw to Dr. Water, Dr. Mark LeChevallier, and we'll take it away.
Thanks, Scott. So I'm going to share the screen now.
Yeah, let's see if it comes through.
There you go. Coming up.
Okay, we good to go?
We are.
Yep.
All right. Let's see. Okay, I guess I have to share it through the webcast. Well, my journey in this started I remember in 2014 being chief environmental officer at that point for American Water, and kind of chief microbiologist. Recall in 2014 there was an Ebola outbreak in Africa, and they brought in some of the doctors and nurses to the United States for treatment that had gotten infected in Ebola. And that special highly contained center they have in Atlanta to treat highly infectious diseases, it was found that the toilets from that facility go right into the collection system. And so despite the fact they have all this other, fail-safes to protect against microbes, the wastewater just went into the sewer system. And that generated a lot of concern around, Ebola in wastewater, and could people get infected? And that just heightened the questions at that time, because we were doing quite a bit of work on developing a safety culture at American Water. And that raised the question, well, what were we doing on our wastewater side of the business? And the answer at that time wasn't very much. Well, then in 2020, this was all revisited again with COVID, and the same kind of fire drill. And less that we don't have to reinvent the wheel each time. Let's try to take some lessons and use the impetus that these various prior events have occurred to kind of learn and implement a day-by-day safety program. But when we stop and think about it, despite Ebola or COVID or anything else, wastewater has many pathogenic microbes in it every day, and actually at a lot higher concentrations than COVID or Ebola ever was. we have bacteria, viruses, protozoa, fungi, and even macroorganisms. And all of these pose a risk, to the worker, whether at the wastewater treatment plant or out in the collection system, or dealing with sludges or septic hauling around. So we'll talk about the safety across the board here. So who's at risk? Well, just a couple different studies have shown that in fact workers at wastewater treatment plants in fact have increased risks. This study in 2001 showed increase in hepatitis A antibodies in wastewater workers. And I try to impress on the workforce, this is real important, because if you get infected with hepatitis A, it affects your liver, and you can't drink alcohol like for a year after infection. So that gets a lot of people's attention. Workers carrying out special tasks like inside confined spaces had exposure to higher level of endotoxins, which are the microbes that might be present in wastewater. And again, another study showed hepatitis A and hepatitis E in the stools of people that worked in wastewater compared to controls. And there are a lot of other studies. So we know that microbes are present in wastewater, and we know that workers, if they're not careful, can become infected from those microbes in wastewater. And how are they spread? Well, we think these are mostly fecal oral pathogens. So any eating, drinking, smoking, or anything where we're putting hands to the mouth can be a route of infection. Also, breathing aerosols, and this was certainly emphasized during the COVID when everyone had to stay 6 feet away and wear a mask. But not very much attention had been given prior to 2020 to the route of infection from wastewater through inhalation. Injection, so if you're working on a piece of equipment, get a scrape or break on the skin, that could be a way to get it. And just skin contact, touching something and having on your skin and then transferring it to other surfaces, can all be these different ways of spreading microbes that might be present in wastewater. And so this emphasizes the use of proper hygiene, hand washing, other control activities, and the proper use of PPE, as Scott had already raised. So where do we find the regulations for requirements for wastewater worker safety? But it's found in the general duty clause from OSHA, and that makes employers responsible for worker safety. Employees should be free from recognized hazards due to serious harms. And we just said wastewater clearly has recognized harms from microbes present, and clear studies have shown its transfer. So it's really incumbent upon employers to make a safe working environment for their employees. And of course, it's incumbent on the employees to recognize that and to use the appropriate safety measures that the employers implement. And because these hazards can vary from different job activities, it's necessary for facility managers and staff to jointly together conduct a job safety or hazard analysis. And so this JSA, or it's called by different names, should be a part of every wastewater treatment plant, where we identify the different activities and the hazards associated with those activities, and have a particular safety plan that includes microbial risks as well as other hazards. And so it's important that management recognizes the responsibility, the hazards identified, and then have a job-specific job safety plan, which might include appropriate PPE. So when we started to get into this into 2014 and did a search of the literature, we didn't find, and despite that many municipalities have lots of different documents online, you can find all kinds of stuff, we didn't find that there were any job safety analysis for any wastewater activities except for the National Park Services. So if a National Park employee went out and cleaned an outhouse out, in the backcountry, there were all kinds of protocols for them to be safe, but major wastewater treatment plants, we didn't find any of that material. So in developing a job safety, so we started doing it on our own. And doing this, you say, well, what are the specific tasks for each job? What are the hazards associated with that tasks? And then what are the control measures that might be applied to reduce those hazards? So here's just one example. It may be a little bit hard to read, but you don't really have to read the details. So we're going to enter a primary clarifier at a wastewater treatment plant. And so, we have to isolate the clarifier, we have to drain the liquids, we have to remove the hatch, we have to access that. And so you think, well, what are the different hazards and what are the different practices, to do confined space entry kind of training, tests for hazardous gases, more the tasks, then perform the cleaning, conduct the final inspection, and then close it back up. So you can think of step through any different tasks that might be done at a wastewater treatment plant. Going out and collecting a sample, you have to identify the location, have the sample bottles, go fill that up. And then for each of these tasks then now listed here, you might identify, well, what are the particular hazards? Is there a potential for getting cuts or scrapes or entering a confined space or electrical hazards? And you would identify, well, what's the probability of that hazard and what's that severity? And then go after and then rank all of these for any particular job. What might be the chemical, microbial, electrical, other kinds of hazards that might be related to any type of job. And then based on those hazards, what are the required approaches to reduce that hazard? So what kind of training do we need to have? What kind of PPE do we have? What kind of signs and limited access? What kind of engineering controls or other administrative controls? And so all of this is part of a job safety analysis. And then once that's done for each job, each employee would be trained on those tasks, on the safety procedures, and make sure that they have the appropriate training, PPE, and engineering controls and what have you to perform that task safely. So we had a workshop to look at all these tasks and identify what would be the appropriate personal protective equipment for each of these. And we identified, well, if you have contact transfer, you want to have glove, boots, and uniform. And here we're primarily talking about microbial risks. So if there's splash hazards, we want to protect the eyes and the face through safety glasses, face shields, or goggles. If there are whole body contact, like you're going into an area where there could be splashes, maybe Tyvek suits or coveralls, abrasion cuts, then durable gloves, and then respiratory, having appropriate respiratory N95 masks or surgical or dust masks. And you can find a summary of all of this in this 2019 paper that's available online on protecting wastewater workers from disease risks. And I believe that that's an open access, so you can log on to that and download this paper. But in that paper, we went through all I think we have some 35 different tasks in here, lift station inspections, sampling, sewer entry, pipe inspection. I'm just going to walk through that. And you can see for each of these, we said, is there a contact transfer risk? Is there a splash risk, a whole body, abrasion, respiratory? And sometimes we said yes, and sometimes we said, well, it's kind of conditional. If you're going into an active sewer, then yeah, definitely. But if it's not flowing, then maybe respiratory risks are not that high. But anyways, for each of these, we stepped through all these different tasks. routine operations. So if you are doing just a visual plant inspection, probably not that much of a safety protocol. But if you are doing, cleaning of sludge, or different maintenance, or working on different pieces of equipment, particularly going into the cleaning the bar screens into the primary treatment room, some of these activities might be different. And then, of course, besides just the PPE, do workers have the appropriate immunizations? And CDC has recommendations for wastewater workers, recommendations for polio, typhoid, hepatitis A and B vaccinations, and tetanus. Anyway, you can find that updated list either for national or in your locality. And so who at risk? Well, basically anybody that's coming in contact with wastewater, collection system personnel, laboratory personnel, biosolids. Sometimes they don't think about that because it's, maybe dried biosolids, but anyone kind of cleaning up and sweeping up after biosolids can think about the dust risks and inhalation of microbes there. And others that might be exposed to fecal contamination, working on sewer overflows or doing inspection of overflow stations, septic handling, landfill leachate, and what have you. So part of this was updated in the Protecting Wastewater Professionals from WEF, and that was, kind of revised during COVID. Now that COVID's over, nobody pays attention anymore. Do we not care about that? No, all these other microbes are still present. And so it is a part of an ongoing program for wastewater safety. So with that, Scott, I'll turn that back to you.
Let's see.
Anna had to unmute us. Thank you, Mark. We appreciate your perspective and that great narrative that you had trying to attack the lessons learned around Ebola. I thought that was really great. So I think we'll move on now to Mary-Francis from Racine. I think you're the first one that's going to have to report out here. We're going to talk a little bit about safety culture and what that looks like in Racine, Wisconsin. Is that right?
Pulling your slide. Yeah. Okay.
Yeah.
Yeah. Give us 1 minute to pull it.
Sorry, we're working through logistical details.
See what's coming in the
I was
future.
thinking next time we should just all go online and then we can just move on.
Well, we could
Slide.
do that.
Yeah,
That
that
might be easier.
We'll learn a lesson.
Yeah, that's the name. It's up above that one.
Maybe just to fill the time, I pulled up some of the safety stats. We were talking about eye injuries, and like I can tell you that in the last
Yep,
eight
there you go.
years,
You had it.
we've had 15 recordable eye injuries.
15.
15 recordable
In
eye
what
injuries.
period of time?
In about 7 years, 8 years. Yeah, so almost every year we have a recordable eye injury.
But how many people is that?
We have a 600-person utility.
Yeah. So,
Perfect.
That's just eye injuries. If you
yeah,
dig into the other recordables that we have.
okay, no, I get it. Hi, everyone. I know we're a small group, but we have some great information for you. If you just click, please. I'm Mary-Francis and I manage the treatment plant in Racine, Wisconsin. We're the 4th largest plant in the state and we're on the shores of beautiful Lake Michigan. If you click, please. Just to give you a little bit of historical perspective, until the 30s, we didn't treat wastewater. Went right to the ditch, went into any of the streams, rivers, and then eventually to Lake Michigan. We did have sewer workers, and that's what they were called. And their whole attitude was, we're gonna do what we have to do to get the job done. Nobody knew about PPE and nobody much cared either. Next, please. Then today, hopefully between that time and now, we've done a 180. We have a whole different perspective. I give a little talk similar that I took most of these slides from to my own staff, and every time I see somebody pull out a camera. And we get to the slide, makes me a little bit nervous. If this is our way of doing, why are you now taking a picture? Anyway, so if you would go to the next slide. that perspective is that our employees want to wear PPE. The attitude now is we're going to do whatever we have to do to be safe. And that comes from the employer and the employee. And we start out by, next slide, please, determining the risks. I can give you a picture real easily of what goes on in our plant, but there's an awful lot of risk out in the field in the collection system for our people. Next, please. And what we do is start by with Mark, I think, called it a job safety analysis. We call it a job hazard analysis. It's the responsibility of the utility, the managers and supervisors, and the employee. If I ask you to do something today, you're going to go pull the JHA if it's a job you've never done. If you don't have a JHA, you are going to sit down with a supervisor and the other people in your department that might be assigned that job. And that form is going to get filled out, and all of those things are going to be taken care of before you can start that job. Next. So our form's a little bit different than what Mark showed, but what looks pretty short here just keeps getting longer. Because in those fill-in sections, when people click something or when they check a box, something else opens up. So doing something that you think is going to take you 15 minutes usually takes you 3 or 4 hours. But that's our culture, and that's really important to us that all of that's taken care of. Next. In order to make sure JHAs are followed, we have all the PPE you could possibly be required to use, and then some. Because if you come and say, I don't like this, I want something different, you're going to get it. I have a whole attitude. I admit it's mine. It took me a while to get everyone else on board with it, but I believe if you're comfortable in your PPE, you're going to wear it. And if you're not, it's going to sit in your locker or lay on the floor next to where you're doing a job. And when I talk about people deciding to wear more PPE than what they need to, I'm talking about time-weighted averages for noise exposures, people just deciding whenever I'm in this room, I'm going to be wearing some type of hearing protection. And we have an awful lot of that. I'll be real honest, I think it's something that most of us wish we had thought of earlier in our careers, at least I do. And we also make sure you get what you want. So 2 weeks ago, I had a young woman start, very small stature, the smallest rain gear we had, she just drowned in. So someone ran to Farm and Fleet and got her rain gear out of the kids department. But now she's comfortable and she's safe doing what we're asking her to do. Next. Then I know a lot of our focus is biological hazards of this conference, and Mark talked about it some. You can't really tell, but this is the picture of the cover of our pandemic continuity of operation plan. RMA to WEF is a 3-state organization. It's Minnesota, Wisconsin, and Illinois. And I believe that of those 3 states, our utility was the only one that had this pandemic continuity of operation plan. It started back the first bird flu, so back before swine flu. We decided we were going to put this plan together. We got pushback, people teasing and joking. They thought it was funny, but I will tell you, on March 24th, my boss called me and he said, figure out what we're going to do. And the 25th, we sat down with our supervisory staff. I thought this was a discussion. Like, here are what I think we should do, but here's everybody's input. And he said, here's your copy, get it going. Nobody's coming in tomorrow unless they're on the list for tomorrow's employees. So we went from day 1 to day 3, and we were down to our minimal staffing without a whole lot of concern or thought having to go into it. Next, please. And then in relation to those biological hazards, most of the PPE that we were telling wastewater workers to use during COVID was stuff we already had on hand. But we found that people felt a lot better if you gave them a kit and you said, here you go, it's all brand new, and this is what we can do to protect you today. If there's more to protect you tomorrow, you will be getting that. Next. So we identify biological hazards. We're looking at viruses, bacteria, and then if you're a wastewater person, you know, you have to look at the exposures in your plant, all of the microorganisms. For us, most of that type of exposure would be within our secondary process. And to share with you, many years ago, I wasn't feeling well for a long period of time. I went to my doctor, he did some testing. He said, you have entamoeba coli. And if you haven't been in this, or this country within the last several weeks, you got it at work. And I will tell you, it was a real strong discussion to get the people above me to realize that. I was an operator at the time, but it really changed the way that we were looking at things. Next, please. And that's about the same time we started looking at what is there available as far as vaccines that employees can be given to keep them safe. And we now offer all of the vaccines listed here. COVID is a new one. Up until really recently, COVID was covered 100% on everyone's insurance. And right now, it's always kind of a little bit iffy. So we're just paying people go get it and I get the invoice. They never have to put out a penny. So I think we're getting there. We have a long way to go. I don't know how you all feel, but this will be an ongoing thing for everyone throughout their entire career. And then the last slide, just to kind of point out some resources, they're out there. If you'd like information from me, I'm happy to share. I know Mark very much made it clear at some point that we should all be putting all of our information out on our website for everybody to grab. I'm gonna have a hard time selling that to our commission. I will tell you, I don't know if personally I agree 100% either, because I have seen, like, our work comp provider has sample programs. I've gone in plants where here it is. It's the exact sample program where they just kind of printed it out and never updated it to themselves. But I'm happy to share. I know Central States, our ME is happy to share. WEF has been like our saving grace because our people feel like WEF is the gold mark. And if I say, here it is, there's your WEF link, they're happy to see that. And then of course the CDC.
Beautiful.
We appreciate that. Seems like you're actually pretty far along in your development of health and safety culture. So good for you guys. Megan, if you would like to talk about LOTT Clean Water Alliances, or does it me next?
Well, we can jump forward. You all see one, there's, Megan has one slide in there somewhere.
Just her talking point.
I'm
Yeah.
sorry. Okay.
I saw mine flash on the screen there. So.
Yeah, you're, so I think. It's all good.
It's not like.
We got you.
That's me.
Yay.
Just one little talking point slide. I'm Meghan Feuk. I have an operations license for the state of Washington, but I work as a lead water quality analyst with LOTT Clean Water Alliance. Our lab is not a public health lab. We perform the regulatory and process control testing for LOTT Clean Water Alliance. It is the local regional wastewater utility for the city of Lacey, Olympia, Tumwater, and Thurston County, which is where LOTT comes from, LOTT. It is a plant that treats 12 million gallons a day on average, but we have surges up to 60 million gallons during storm events. We're an advanced biological nutrient removal plant and have one of the most stringent discharge permits in Puget Sound. Especially during the summer months, we're allowed to discharge 3 milligram per liter total inorganic nitrogen. And most plants in our area either have a permit around 10 milligrams per liter or don't have a discharge limit on total nitrogen, just ammonia. So they're very, very stringent because we're right on the base of Puget Sound where there's not a lot of mixing. So everyone where I work is very proud of the fact that we're able to meet that. We have about 80-ish employees, 50 of which are facilities, about 22-ish of those are operators, and only 3 of us in the laboratory staff. Most operator schedules are 10-hour days, 4 days a week, 365 days a year, holidays, weekends, the whole deal. They have day and swing shifts, but overnight it is a call out only system if there's alarms that call people out. The lab staff does not have as crazy as hours as that, but we still do staff on weekends and holidays and work very closely with all of the rest of facilities to make sure that we can test whatever needs to be tested to make sure we meet permit, that the plant is running properly. And we all participate pretty equally in the safety culture there at LOTT. So safety-wise, in addition to some of the other federal regulations mentioned, we have the Washington Administrative Codes as well, our WACs, that provide guidance. And that's kind of where it gets interesting for me because we've had quite a few management changes in our safety manager position over the years. The person who did manage the plant safety manager position retired after 30 plus years, and there was a weird transition period over a year before they picked and trained up an internal candidate who just happens to be my best friend, Julie. So shout out to Julie. And so with her fresh eyes on the program, she found discrepancies in how we were addressing wax, and there was a huge movement on her part to get us up to date on things like proper fall protection, respirator use, confined space entries, these things that are very important with keeping your operators and your staff safe. And so any kind of updates on things like that can be a huge ask when you've had however many years of doing things the same way. You get into a flow, and it can be difficult. So how do we then get our people to want to participate in safety? And so safety and health at our place honestly has a lot to do with behavior management. The way Julie, our safety manager, talks about this, her safety program it's people first, safety second. And that's not to say that safety isn't important, but it's rather empowering your people first to have the knowledge and keep themselves safe and have buy-in to the program will bring a much more lasting change than just having this list of protocols of this is what you need to do. And if you don't do this, there's consequences. So that's kind of her approach to our safety culture. So first off, we do have a safety incentive program that's linked with our wellness program. So if you participate in safety trainings, you report hazards, you perform inspections, those count for points. And at the end of the year, those points actually equal dollar amounts that get put into a gift card. There's like a little email at the end of the year everybody waits for, with like a little list of places you can get a gift card from, and you get to choose your little gift card. It goes a long way. The next thing she does is she tries to get CEUs for operators for trainings as much as she possibly can. And that's a lot of extra work with Julie and talking with our state certification group. But even a like 0.1 credit hour for an internal meeting that an operator doesn't have to go outside of the plant for, doesn't have to track down training, doesn't have to do reimbursement, makes operators' lives easier and provides buy-in. We also provide reimbursements for vaccinations to prevent future exposure, and really promote easy access to PPE. The location of your PPE is just as important to operators, because if you have to go into a separate building to open a separate cabinet, it's not as likely as it'll get used. Then there is the Labor Management Committee. So I'm part of the union side of the Labor Management Committee. It's a collaboration of some unionized staff and select management, and we get together monthly to address internal issues and have a place to have hard conversations. It's sort of a place we can use to address potential changes in safety protocols, what updates there might be, union concerns about changes, what people might complain about, what's comfortable, what's not. And even just the wording of the requirements that are being written down and being issued, getting that union buy-in and having management and union on the same page is super helpful. And it gives a place for context to be provided as about why these safety things need to be updated and what has happened that has sort of initiated these changes. And then, so safety culture has had, like I said, a lot of focus at LOTT, and this new style has really been interesting to experience that change. So traditionally, every operator in their first year is warned that they will get sick, but then your immune system is just going to take care of it and you'll be fine. They call this the poo flu, wet well wonkies, or the sludge bug. And from my experience, this acceptance of risk tends to increase over time. So if you're exposed to the same dangers and nothing happens over time, it leads to you having conversations about wearing gloves with people who have worked there for 35 years and should know better, but they're like, it's been fine, why should I? So it's not even really just a wastewater worker thing. This is a very human psychological reaction. Feeling safe for a long period of time can sometimes blind you to what risks are present. And so that's why empowering staff to have that buy-in into that safety culture with the context of why these asks are happening is important. And so any ask, any requirement when you're developing that safety culture, it's just going to take time, and it always takes more time than you want it to. And one way to help it along, I've found, is to exemplify what behavior you're trying to affect. If you don't do it, they won't either. If you don't provide context, they'll question, why does it even matter? And being vulnerable and being okay with maybe looking a little silly to be safe really does make an impression. Change is always hard. And that is also a human psychological just reality. We're used to patterns, and operators have a flow, and anything outside of a flow is going to have an initial reaction of resistance. So building relationships really helps. Sometimes you can ease somebody into a new safety program if you have like a type of harness, but sometimes you see someone not wearing gloves because what they're handling, it needs an immediate response. And if you have a good relationship, like asking for a correction to a behavior, if you don't have a good relationship, asking for a correction to behavior can cause resentment, and that is not going to help you in the long term. And then you want to get buy-in. There's a lot of talk about that. So if you want to update something, you want a new protocol, you want to get your staff to be part of the change as much as possible. That comfort level, new flashlights, try out some new flashlights. Tell me which one works the best for you. Get the feedback and make sure they know that you're listening to the feedback and you're responding to it appropriately because you believe that they deserve to be saved. And labor management can also help with that kind of buy-in, having them being part of that overall conversation. And then finally, managing emotions. Safety and risk has this huge psychological component, and there's this reactivity when you are trying to get someone to change. There are studies on psychological safety where if you are empowered and feel safe, it can actually lead to sharing observed risk and having people comfortable speaking up when you see something that's not right, which is what you kind of want in a safety culture to prevent potential events from happening. And I would say whenever observing a behavior that needs correction, like the way you approach it really matters. You need to really try and reduce potential shame or embarrassment. You want to find a way to prevent resentment. A lot of that times it means not bringing it up in front of everybody, having sort of some strategy when you actually deal with a person and having it be one-on-one and personal. And so operators feel really deeply, they're very deeply feeling people. Often the job, they feel deeply about their job, and often the job comes first before anything else. And so I would say one of the things that also is important, tell them you care about them being safe. I guarantee you they don't hear it often, and it can go actually a very long way. And so just as a conclusion, providing education, providing context, providing guidance, creating a place where you're empowered in a way they will do the safe thing, even if you're unobserved. And the other thing is to know there's no such thing as perfectly safe. You can do everything right and still have to use an eye wash. But if that person is alone, they have a chance then to be empowered to know what they need to do to keep themselves safe. Thank you.
Thank you, Megan. We appreciate that perspective. I believe that I may be next.
You may be.
All right. So just to give you guys kind of a kickoff and understanding, since everybody else provided it and I didn't have it, the Metropolitan Sewer District of Greater Cincinnati treats about 185 million gallons of wastewater a day through 9 wastewater treatment plants. That's on a dry day. For a wet weather influenced area. So that can get up to 600 million gallons a day, 600 million gallons a day that we put through all our plants. So that context is, I think, good to know when I talk about MSD's safety culture. We have about 600 employees. We have a fair number of operating divisions, but you have our wastewater treatment division, and maintenance division, which maintains and operates the treatment plants. And then you have our collection division, which maintains the 3,000 miles of sewer that feed into our wastewater treatment plants. So next slide. I'm going to talk first a little bit about, and some of these other folks talk through about, the PPE programs, but we have this kind of conversation that's been going on around, we have a PPE program that doesn't have any enforceable language in it. And that has been a problem, I think, historically, from past safety management prior to essentially changing up how we do safety. And I'll talk more about that later on, but we're working to kind of standardize these across these programs and policies across all of our operating divisions. But in general, what we do is we perform PPE hazard assessments for all the areas of our operations, right? We have that down to a science. We've gone through and done all of that. And we have job hazard analyses for those areas too, and the tasks that are associated with all of the things that we do. We have a very robust JHA library. But every time we have an incident and we go back and review training records, we have no record of people actually reviewing job hazard analyses. And that's a problem. I think that you guys might have a pretty robust safety culture. I would say generally we don't right now. But generally, most places at MSD, their process areas or construction sites require 4 pieces of PPE. Nobody ever wears them, though. I'll go ahead and say that. A hard hat, safety glasses, steel toe, and high-vis clothing. So if you could switch slides. The PPE requirements, depending on what division you're in, can shift also. So like our engineering group, they have inspectors that monitor construction sites. So like they have a different PPE policy PPE guidance that they use. They don't have a policy, so nobody wears it. In the treatment plants, it's a little bit different. In our laboratory, which is housed in my division, and not to like pat the division that I oversee on the back, but the laboratory has the most robust safety culture of any place in the utility and any place in the city of Cincinnati in general, which I think is really great. And it was homegrown in there from the people owning the work that they did, and a specific champion for safety that was in there still works there. She's a branch chief that works for me now, and she oversees now the laboratory and our industrial pretreatment arm. So she's trying to take that safety culture and bring it into the industrial pretreatment arm. The collection system, the workers that work in the collection system, they are way better with wearing PPE and understanding risks of their work. And they have a really robust JHA library that they don't review either. I don't know how it works, but they all wear PPE, but they actually are the ones they are the ones that have the most injuries in that division, because of the type of work that they do. If you guys have ever been out and observed a collection system job where you're, doing trenching excavation or something like that and getting down into an area and installing a clean out or something like that, it's a very labor intensive job if you're doing it. So they get hurt a lot of overexertions that happen during that. And then industrial user sites are also treated a little bit differently. Our industrial pretreatment group historically has just been wearing the PPE of the site that they were visiting, which I don't know that that's necessarily the best way to handle that. We've taken it a bit further and established baseline PPE that they have to wear in any place where they're doing industrial investigations or sampling or anything like that. And then depending on different situations, other PPE may be required. Obviously, you guys talked about it. Areas where we do really good with HAZCOM and signage for hearing protection and also respiratory protection. And I'll tell you, I spoke about the eye injuries that we've had over the past couple of years. Nobody wears face shields or safety glasses when they're out and doing work. It's something I observe all the time, and always keep an extra set with you if you're ever out in the field. Toss it to somebody and give it to them. You should be wearing this. Some instances that you may be required to wear a lab coat, but as you can see, that's very different across all the operating divisions in the sewer district. And one of the things I've been trying to do, if you switch sides, is create a more uniform PPE space, right? I don't want to necessarily call it a policy, but that's what our leadership wants. They want something enforceable in the end. But that's something that I've been kind of championing at the utility, and I run into issues in how it's presented with the labor management committee and talking through it there. It's not popular with the union rank and file. It's not popular with management also because there's thoughts on how it could change morale if you start enforcing this PPE policy, right? So it's not popular in the divisions that get hurt a lot. But overall, I think that there's kind of a lack of top-down safety messaging and accountability that exists at the utility, and I'm being very frank with you guys. I think I can do that. But there's a hurry up and get the job done kind of attitude, and just in general, not just at the sewer district, it's all across the city departments that operate at the city of Cincinnati. There's a really poor safety culture. And we're currently rethinking how to approach this in concert with our operating divisions, and we're doing it really only in the wastewater utility, but there's also some folks at water who experience the same types of problems that we do that are rethinking this too right now. So we have some working groups together. So one of the things that I've started doing is I don't know why I'm interested in this, but I'm interested in benchmarking against our performance against other utilities. So I've started looking at lagging indicators like your total recordable incident rate, your days of wage and restricted time incident rate, and your lost time incident rates. And if these aren't things that you guys have ever heard of or talk about, they're very common in industry. And OSHA benchmarks all private industry. You can look up what incident rates are, these types of incident rates across different industrial sectors. And I think the average for water and wastewater utilities last year was like in the threes, I believe, if I remember correctly. And right now we're sitting at about 5.8. You guys don't know what that means if I don't talk about it, but it's above the national average, right? So we're trying to get to a point where we're at least as good as the national average. And but there's a conversation around whether you should even care about lagging indicators in this, in if you follow any safety Reddits or anything like that, like me, I'm a nerd when it comes to that. Whether you should talk about lagging indicators. So we started thinking about leading indicators too. So we have some, we are incentivizing folks to report near misses and also tracking things like training hours complete and site safety audits completed and things like that to try to get a picture of using past data that we had reconstruct kind of what our safety performances look like over, I think it's the past 12 years. So if you switch slides, I'll give you kind of an indication of what that looks like. So this is our recordable incident rate plotted over time here, and how many recordable injuries that we have over the last, you guys can't really see me, but like, this is how you calculate total recordable incident rate. But we have a lot of recordable injuries at our utility.
Incident rate per what? How many people?
It's normalized based on how many people you work at your utility times a multiplier that allows you to benchmark, right? So you use the number of hours worked and then your recordables in the last 365 days. But you can see it kind of tracks over time, and we have periods where we're good, periods where we're bad. We're currently in a period where we were really bad in Q3 and Q4 of 2024. We had, and it wasn't just an MSD, but we had incredible amounts of injuries across the city as a whole. Mostly due to overexertion, like doing hard, collection system work, or if you're talking about the water space over Greater Cincinnati Waterworks, it's the folks that work out in their water distribution system that are out there repairing water main breaks, right? And if you start looking at how those folks were trained, which is something we started doing retrospectively, and that's where we found that like these job hazard analyses existed, but the people that were doing that work had never reviewed them. So that's an area of improvement I think that we need to work on as a utility. And, just from a benchmarking perspective, understanding what types of injuries we've had over time and where they've happened at in the different divisions is something that we've never really thought of before. So we could switch to the next slide. These are our incident rates over the last year. We're trending down in the right direction, but we're still really high. The city's average, it was plotted on that last one for recordable incident rate. It was about 7 or so, and we're currently below that. So we're doing better than the rest of the city if you're benchmarking against the rest of the city. And I can't remember if I put one last slide on there that showed another slicer. Can you switch slides real quick? Is that it? Or that was it? One more past that. Oh, okay. So this is a dashboard that we created in Power BI. The other ones were too, but we're tracking over time, and reporting out to senior management how many recordable injuries that we have, every operations meeting that we have every 2 weeks. And then we report out, as the safety manager and I report out any findings from the investigations that we had of those incidents, and any root causes that we might have identified during them, and any corrective measures that might need to come from that, like training, reviewing of job hazard analyses, different types of recommendations that we might make. But I think this is an interesting way to start looking at past data, because we were collecting this, but we never had any visualizations of it before, right? It was going into a human resource database and into a black hole that nobody ever looked at. So one of the things that I did when I started, and I've been overseeing health and safety at the utility directly for about 2.5 years. Well, I shouldn't say that, through a manager for about 2.5 years, and now kind of indirectly as the superintendent of the division, chief of the division, for about a year now. And having this visibility into past safety performance and presenting this to leadership of the operating divisions has been instrumental in them understanding where problems are in their in the types of work that they do. So being able to go in and see that, this year we've had 6 strains and sprains, right? And a couple of bruises and contusions. Those are harder to deal with, but these are all recordables, by the way, if you speak in that language. But like overexertion, sprains, strains, tears are the big drivers. So then we can target safety training initiatives, toolbox talks, things like that, towards the people that are experiencing these injuries. So we're trying to use a data-driven approach to do targeted safety intervention. I don't know that that's the best way to do it, but in a place that has so many injuries and a fairly poor safety culture, I feel like you kind of got to start somewhere, and that's where we started. So I'm interested in other utilities, and if they're online, if you're calculating these incident rates and how we stack up against other similar sized utilities, because I know that the Northeast Ohio Regional Sewer District too is the shining star on social media. In Ohio, they have a much better safety culture than we do, and they don't experience the number of recordable injuries that we do, and we do the same exact work, So I think it's a conversation that's worth expanding on beyond this room, and I don't know what it looks like, but Anna, maybe you can talk about a call to action.
I'm gonna talk about a call to action. Thank you.
Yeah.
Okay, so we gave you a lot to think about, and so there's, on the one hand, knowing the right thing to do, and Mark talked about that, and we've talked about the right PPE and all that. On the other hand, there's having a safety culture that embraces doing the right thing. You're looking at representatives from big to really big utilities. There are a lot of much smaller facilities out there that are less well resourced. So I always think about the little guys and how can we equitably support, a safety culture across, all of our members as WEF. So this is a very selfish slide because I'm from WEF. And I'm very happy to hear that you think that the materials we put out are the gold standard and that's awesome. I want to make this a project of WEF. I want us to support health and safety for wastewater professionals better. And so I want to know, what are the top 3 things I should focus on? So I came up with 3 things, just pluck them out of the air. And I want this to be part of, we can keep the conversation going, and I'd love your all feedback and folks online. So I came up with these 3 things, and you talked a lot about injuries. I'm thinking a lot about pathogen exposure and illness, which doesn't show up on your dashboard unless it's a recordable, unless you have to go get antibiotics.
That's right.
Yeah.
So
Okay. So can we do a better job, number one, of tracking the health impacts responsibly and more comprehensively? Now, we don't want to add hugely to the administrative burden of utilities. I get that. But is there a way to develop a system to comprehensively monitor missed work? You're just going to get sick. You're just going to miss work your first year due to infectious disease. but also safeguard worker privacy. I don't know. Maybe we can, maybe we can't. The second one I thought we could focus on is dispelling this superhuman immunity myth. I hear it over and over and over again. It doesn't matter. I'm going to get sick, but then I'm going to be fine. And Mark is the one who pointed out, so thank you, Mark, that there are real risks associated with asymptomatic transmission to your loved ones at home. Even if you are not sick, you can still get your loved ones sick down the line. And also reinforce this idea that being sick is not a rite of passage. It was for Mary-Francis, but it doesn't have to be for everybody else. And that was a serious illness.
Yeah.
And then the third one I came up with is centralized tools for safer workplaces. So you talked about, maybe the call to share job hazard analyses, job safety analyses, or whatever, maybe, and the danger associated with just cutting and pasting some of that stuff that's available. But is there another way to do that? Have a hub of something where the smaller guys can go, the smaller systems can go and get that information. So this is my very preliminary call to action. I look forward to everybody's feedback. That's it. I'm done.
Awesome. Thank you, Anna. All right. Great. Well, I think we got about 4 minutes left.
Yeah, that's your timekeeper over there.
For questions?
Yeah, I mean, if there are
we
questions, we could probably extend it, but let's.
Yeah, so, go ahead.
And forgive me, because my expertise is not in the wastewater end. I compared the safety issues to looking in research labs and in hospitals and in public health. Do you have a national authority that can, besides us, but a real national authority that comes in and inspects you every so often and makes sure that your employees are abiding by some national standard of PPE that's required? No, so you're like research labs as opposed to hospitals.
For us, it's not national, but the state adopts everything OSHA puts out. And then the state inspectors come in and they do two different types of inspections. One, they call you up and they say, I'll be there in 2 weeks, so be ready for me. And then they do the kind where they just come knocking on the door and they do a full out inspection of whatever they've decided the focus is at that time. And we've had both. I think they do a very good job. People get pretty nervous, but they're only there to help you.
But that's up to your state to
Right,
decide
it's
to
up
do
to
that.
the state.
Ohio decide not to
Yeah.
do that. So it's not like Medicare where every state has.
That's a good point. And you've got Wisconsin, Washington, and Ohio. We don't know where, yeah.
And do you have a national telephone line where people can call in, especially from small areas, to make reports about, they're not giving us PPE, or we think we should get this
No.
PPE, or
I love that idea.
Okay, just so you know, there is one for hospital and health workers. And if a hospital or health agency does anything to prevent you from calling or reprisal for calling, you can lose your license to provide medical care or hospital care.
Okay, I'm gonna talk to you more about
Okay.
that for sure. I love that.
The state of Ohio is very, very similar, to the state of Wisconsin, but we never get inspected.
Oh, interesting.
Yeah.
Do you get inspected?
We, we do a lot of internal inspections. Julie has it set up so that she comes through the lab at least quarterly, if not more often. And then, also we have different, staff members that volunteer for inspections, so that do like a little surprise come through, and they do actually find different stuff through the lab. It's a little different for out in the plant. Usually it's Julie doing the safety inspection, but, I know that on occasion, when there's something that we are unsure if we are doing it well enough, we can and have asked for L&I to come in as a consultant to take a look at through things. And that again, sometimes very scary for people, but they're there. Yeah.
Okay.
Yeah.
We have a question on Zoom. So Rachel asked, do you all feel that public health agencies and organizations do enough to champion utility workers as public health partners that deserve better or more tailored guidance and protection? And she says, I know that web helps us there quite a bit, but are there other things you'd like to see?
Well, yes, share that.
I often do, I'm sure I'm biased, but I do often feel like operators kind of get forgotten a little bit in the realm of public health. And they would never say that out loud. What the solution to that is, I'm not entirely sure. I think one of the things from this conference that has kind of made me think a little more is I don't know that other than a couple of people I've met here, if folks from public health have toured a wastewater treatment plant to sort of get an idea of what that even means. So that might be a way to start, but then, you know, that might not be something that you could do depending on, you know, location and whatnot. But I think operators want to be recognized more and do take a lot of pride in the fact that they are protecting the health of their communities. Most of the operators I know are avid outdoors people, really value their environment, and care very deeply and do crazy hours of work. And one of the things that is still often mentioned sotto voce is the pandemic and how that affected wastewater operators. And even though being, you know, essential workers, they weren't necessarily as recognized. And again, they would never say that out loud, I don't think, but it is something that is kind of a continuing underlying thing when there's these different interactions. There's kind of this memory of like, are we really seen, you know?
Think we're good?
I think that wraps up the Q&A portion.
Great.
Thanks, everyone.
Thank you, everyone. Oh, great.